Welcome back to the Explainer series, everyone. Look, if you're a medical coder, a biller, or a physical therapy clinician, you already know that accurately capturing treatments can be incredibly nuanced. Today, we're supercharging your knowledge with part 4 of our physical therapy masterclass. We're zeroing in on a very specific family of treatments, the thermal, hydro, and light-based supervised modalities. We're going to decode the clinical applications and the strict billing rules for CPT codes 97018 through 97028. Let's dive in. Here is our quick agenda for today. 1. Supervised Modalities Overview. 2. Paraffin Bath CPT 97018. 3. Whirlpool Therapy CPT 97022. 4. Diathermy and Ultraviolet Light. 5. Untimed Billing Rules. And 6. Outro and Next Explainer. Section 1. Supervised Modalities Overview. So, the CPT range from 97010 to 97028 covers supervised modalities. By definition, this involves applying a modality to one or more areas of the patient's body. Now, the absolute key word here is supervised. What does that actually mean for you? Well, these treatments don't require constant one-on-one attendance by the provider for the entire duration, but, and this is crucial, the provider literally must be present in the clinic to oversee the safe delivery of the service. Section 2. Paraffin Bath, CPT 97018. From a clinical perspective, what exactly are we coding when we use 97018? It's essentially a machine unit utilizing paraffin wax. This wax is applied right over the specific extremity of interest to deliver superficial moisturizing heat. Fun fact for you, paraffin wax has actually been used for therapeutic pain relief since the Roman Empire. But today, we're coding it with absolute precision. This isn't just about casually warming up a joint. It's a highly targeted thermal therapy designed to penetrate those irregular surfaces, especially on the hands and feet. Let's look at how this plays out in clinical practice. Providers generally use one of 3 distinct application techniques. And as a coder, you might spot any of these in the documentation. First up is dipping, where the body part is dipped into the bath and quickly removed to build up a nice coating of wax. They'll repeat this 7 to 12 times, then wrap the area in wax paper or a plastic bag and cover it with towels to really trap that heat in. The second method is immersion. This is where those serial dips are followed by leaving the body part completely submerged in the bath for a full 30 minutes. Finally, there's brushing, where they literally use a brush to paint the paraffin onto larger body parts that just can't be easily dipped. Now, what about medical necessity? Paraffin baths are incredibly effective for patients dealing with rheumatoid arthritis, osteoarthritis, trauma, contractures, and scleroderma. It's a fantastic way to improve precision grip and offer short-term pain relief, which really boosts the patient's quality of life. However, you have to watch out for the strict contraindications, specifically open wounds and rashes. Applying hot wax to broken or irritated skin is a massive safety hazard, so you should absolutely never see CPT 97018 billed alongside those specific patient presentations. Section 3. Whirlpool Therapy, CPT 97022. This modality is exactly what it sounds like, submersing a portion of the patient's body into a heated water bath. Often, you'll see the patient performing specific physical therapy exercises while they're submerged. The therapeutic magic here relies on pulsating water jets, creating a swirling motion. This mechanical action, when you combine it with the heat, works perfectly to relax those muscles, significantly drop tension, and promote healthy, rich circulation right to the targeted area. Medical necessity for the Whirlpool is also clearly drawn. Your documentation for CPT 97022 should point toward indications like stress relief, edema, or pain management for conditions like Achilles tendonitis, plantar fasciitis, and ankle sprains. It's truly a great tool for improving flexibility. But again, contraindications are key. It is absolutely contraindicated, meaning do not use it under any circumstances, if the patient has active thrombosis, severe circulatory insufficiency, acute infections with a fever, eczema, or purulent infections. Section 4. Diathermy and Ultraviolet Light. First step here is diathermy, billed under CPT 97024. Now, unlike the superficial heat we just talked about with a paraffin bath, a diathermy machine converts electromagnetic microwaves into thermal energy to provide deep heat directly to the tissues. The provider sets up capacitor electrodes opposite one another on the patient's body, and this induces that deep heat, triggering both thermal and non-thermal physiologic effects. While it's fantastic for deep tissue issues like bursitis or tendonitis, coders really must note that deep heat therapies like diathermy and even radiant heat treatments like infrared under CPT 97026 come with very strict safety rules. They are often strictly contraindicated for patients with metal implants or those who are pregnant. Conversely, we have ultraviolet, or UV therapy, which is CPT 97028. This modality relies on high-energy electromagnetic radiation. There are actually 3 types of UV light, A, B, and C. Type A is widely recognized as the safest of the bunch. The technique used here is highly controlled. Providers aim small, directed doses of UV light right at a specific body part to render the treatment safely without causing any tissue damage. So, the crucial question for us is, why would a physical therapist utilize UV light? Well, the clinical indications are wonderfully diverse. You're going to see CPT 97028 used for stimulating collagen metabolism, promoting wound healing, and localized pain control. It's even utilized for broader systemic issues like seasonal affective disorders, commonly known as SAD, treating vitamin D deficiency, managing various skin disorders, and even as an alternate modality for immunomodulation. Just be on the lookout for contraindications in the chart, like dry skin or patients who are currently taking photosensitizing medications.
Section 5. Untimed Billing Rules.
Okay, let's tie this all together. All of the supervised modalities we just discussed, from CPT 97010 through 97028, are classified as untimed services. An untimed service basically means the treatment modality is not defined by a specific time frame. Unlike constant attendance codes that get billed for each 15 minutes of service, untimed codes are entirely service-based. Think about it like this. It doesn't matter if that paraffin bath takes 10 minutes or 30 minutes, the code itself represents the entire service event. Because they aren't bound by time, the billing rules are incredibly strict. Untimed services are billed based strictly on the number of times the procedure is performed. Crucially, they're usually billed only once per day per patient, regardless of how many areas are treated. So if a patient gets a Whirlpool treatment on their left ankle and then on their right ankle, you generally still only bill one single unit of 97022. If a scenario pops up where you absolutely must bill more than one unit of an untimed service in a single day, you are going to need significant, robust documentation to justify that medical necessity to the payer. Otherwise, expected denial.
Section 6. Outro and Next Explainer.
I really hope this breakdown brought some solid clarity to your coding workflow. Join us next time for part 5 of our masterclass, where we're going to pivot away from these untimed codes and tackle the timed, constant attendance modalities. We'll be breaking down manual e-stim, laser therapies, and iontophoresis. You definitely won't want to miss how the 15-minute rules apply there. Thank you so much for joining me today. Keep asking those tough questions and keep studying those CPT definitions. Before you go, I want to leave you with this question. Is your clinic's documentation truly robust enough to survive an audit on these untimed codes? Think about it. Until next time, decode healthcare with Harshal.